the industry infrastructure is always meant early adoption of the infrastructure. So we know that what type of expression system we need to choose and what type of infrastructure we need to have. But definitely in the manpower selection, we are facing the challenges. So upstream, downstream, the manpower who is expert in those areas. So that is a major challenge now we are getting. So we request like academia should have such type of courses in program in biotechnology or somewhere where upstream and downstream technologies are more detailed explored in a way that they can be industry ready. And another area is that we just want that early partnership with the academia. Like proof of concept is ready, either you just communicate to 10 companies, maybe the one will come up. So that has to be like, there is a industry academia collaboration is there, but let us more ignite it in the way that more number of companies can interact with you. Maybe they will reject it. So maybe with the more refinement of the data. So our country can get benefited from those such technologies from the academia.
So that's very nice to hear all of you. I think Dr. Roy said, about regulatory and quality, Dr. Ravi brought in. I have seen, having worked in industry for 25 years, I've seen something very interesting. Whether the students coming from NIPER or any IIT or any university, first thing they forget what? I will tell you. In the school and in the graduation, when we write our experimental book, we write what is the objective, what is the methodology, what is the requirement, what is the result, what's the conclusion. Let me tell you, 80% of the guys who are moving into industry, they don't follow this. They forget it. And end result is what? If someday some result is accepted, no one in the company knows what was the logic why this result was accepted. Nobody knows what was the logic why this experiment was done. Nobody knows whether experiment number 20 is actually a concluding experiment of the experiment number 1. This is a huge issue. We talk of biotechnology, we talk of bioinformatics, we talk of a lot of things. The only suggestion which I speak at different platforms is the faculty at NIPER, the faculty at ISER, the faculty at IMTech, the faculty at IIT Bombay has to speak language of regulation. The faculty itself is far away from the language of regulation. You can't teach it to your students unless you speak. So that is a suggestion that any institution of this strength should bring in that language into a daily discussion. Then only we'll see those turnaround results which we are looking for. Yeah. Just few comments which I had.
Yeah, definitely. Thank you. Thank you very much. Any? Yeah.
Thank you, sir, for entire panel for nice discussion. So, it's a submission to the entire panelist in terms of all of your eminent biologists or immunologists, and I come from a different background, which is not definitely biology. So that's why I'm putting it, I'm working in the interface of biology and engineering. So from that, I realize that now this madam speaks about the organ-on-chip technology, and we are going for environment-friendly solutions. And the affordability, one of the point came out throughout the discussion. So I'm just putting it that in terms of a biological research, from my own experience of doing some DNA-based diagnostic, we generate a huge amount of plastic waste. So how we can take care, or what's your opinion, how we could take care or reduce this? This could lead to one of the issue of environment sustainability and as well as the cost. So if you just speak about that, what's your vision and how it can be taken forward? Thank you.
Thank you. That's a very, very significant question which you have asked. And this is something the diagnostic industry is thinking about. Why it's so? If you look at COVID, if you look at swabs, we have generated billions and billions of plastic swabs. We are generating billions and billions of plastic assets, and now the world is moving into it, right? And this is what we just started thinking. Let me tell you, nobody's working on it. The first solution is biodegradable plastic. That's the first solution. But the advantage here also is that most of this bioinfectious plastics, which gets into diagnostics, also goes into incineration. So the mass is reduced. What we really see, it's look big when it goes into production. But as a matter of disposing it, it gets into incineration by way of essentiality. Yes, all the self-testing, like for example, if you talk of pregnancy testing or if you talk of self-testing of COVID now, yes, there is a big challenge. It's getting into municipal waste. Yeah. It's not getting into hospital waste.
So that is one of the challenge. Yeah.
Exactly. So there are two things which we are working, we are working with Tata Steel Limited. I'm a consultant to them. We are working on a material where if we can bring this plastics which can be biodegradable, right? It's a long journey. It will take a long time, but very, very significant question raised.
Yeah, thank you.
Yeah, I may want to add it. Yeah, I absolutely agree. See, this plastic pollution is a really big problem for mankind, not only for us, and an attempt to provide some solution to this is going on throughout the globe. As Sir said, biodegradable plastic, limited use of plastic, a substitute for plastics. So things are working on this because we realize that we are damaging the climate very recently. Earlier we were exploiting like anything. We means as a human. So whether by using a fuel, reserve fuel, that is a problem. Plastic pollution. There are so many disciplines. And what I read is, government across the globe, they are getting serious now and realizing the importance that we are destroying ourselves. Measures have been initiated. But unless and until it comes to the grassroots level, individual entity on this globe, if they do not know what they are damaging by, by their actions, I think percolation of information and knowledge is also going to play an important role. So yes, plastic pollution is a global problem and people are looking for it and hopefully we'll find some solution to it. Thank you.
Thank you. Any other point?
Comment on that's very important point you raise, and why I want to comment, because I work in industry for 13 years in GSK and biological advance, so and in academia in almost, so I know both the environment. So yeah, that's true. We need to teach our fellow in terms of particularly the quality management system, what we term in terms of the data recording, in terms of the protocol and everything. Yeah, I mean, that is not something that, applicable to every field, particularly for the field which is having the translational value. It's going to potentially translate. Those kind of SOP and the validated protocol kind of training need to be given, of course. The things is improving, I must say, because most of these organizations are now getting this incubation center and those kind of things incorporated, like we have iShare, NIPER, everyone is having. So it's not really, I mean, it's moving in a positive direction. We are training, we are trying to train the student in that way also, who are interested in the translational science, that if you want to go any translational or industry, then you need to have a this kind of consideration you need to do along with the routine thing you do. So yeah, that's what I wanted to comment. Thank you.
Yeah, so coming to that point, suppose if you have identified any protein or any target candidate for the vaccines or biologicals or monoclonal antibody, so my request is here to finalize the specifications early. That is one of the robust success factor, I will say. So like whatever parameters you have developed so far, make some list of the specification in consideration of the regulatory guidelines. So it will help to file the IND very easy. Otherwise, the hard work will go again and again in pipeline. So in that point, I think, conclude these sessions, and thank you all panelists. Thank you.
I just wanted to make a small comment here, as Ravi also said and Sanjeev also mentioned. So we, as an academia, realize this, that 70% of our research is not reproducible. I'm accepting it. 50% of our own research is not reproduced by us. 70% is not reproduced by others. 50% of our own research is not reproduced by us. And the onus lies on that we do not have, standardized equipments. We do not have accreditations of our lab protocols. And that is where, so once your graduate student moves on, the other one takes up, and there are changes in protocols. You don't even realize that the student has changed the protocol. So these are very, very important things, and we all need to keep in mind if we really want to see our science getting translated. Thank you, sir.
Very right. Thank you. Thank you.
More enthusiastic. Thank you. Thank you, sir. Now I call upon Professor Sharma to actually felicitate our chairpersons. Yes. Please join. Thank you, Dr. Jain. And I also request Director Kolkata to felicitate our co-chairperson, Dr. Ipsita Rai. I request all actual speakers to join for a group photograph. Thanks for all of you. So before breaking for the lunch, actually I would like to make a small announcement actually to the participants sitting over here. Please convey to your friends also. You are requested to collect your certificate from the Friday evening up to the Saturday evening from the certification committee desk. You can pass it on to your friends also, who is hearing. Okay, I will make the announcement afterwards also. Thank you.
I thank all the audience. I think everyone becoming hypoglycemic. Sorry for that, actually, for the delay lunch, actually. So I invite all of you for the lunch, please. Yeah, thank you. And we'll meet at 2 o'clock actually sharp for the next session. Actually, that's also going to be very interesting on pharmacoinformatics and artificial intelligence in this particular hall. Thank you very much.